The Ministry of Agriculture, Water and Land Reform is currently conducting a foot and mouth disease mass vaccination campaign in the Zambezi following outbreaks of the disease in various villages in the region on numerous occasions this year, further resulting in the temporary ban on livestock movement within and out of the Zambezi region. Now joining us on the line this morning with an update on the foot and mouth disease vaccination campaign is State Veterinarian in the Ministry of Agriculture, that is Dr. Elago Simeon. Good morning, Doctor, and welcome.
Good morning, and thank you for having me.
Right. Now, Doctor, before we get into our conversation regarding the mass vaccination campaign, please give us a brief background of the outbreak of the foot and mouth disease within the Zambezi region in 2021.
Okay, thank you. First of all, good morning, listeners. The outbreak for FMD started in the Zambezi region. It was picked up on the 27th of May this year, and it was confirmed on the 3rd of June. So we did some disease investigation to see the extent of the disease, because there were a few farmers who were reporting animals salivating and having wounds on their tongues and between the hooves, and with no appetite and stuff like that. So the officials in the region went to do investigation, and samples were taken, and therefore the cases, the usual cases of FMD, the usual types that you usually have, were picked up, and that's SAT1 and 2. So basically that's how it started, and then we started emergency vaccination campaign, initially targeting 100% of all cattle that are within 30-kilometer radius around the affected areas. So when it went on, we started noticing that the cases are not residing beside a good vaccination coverage, and we had to do further investigation. More samples were taken, and we wanted to see if there's any other type of FMD virus that's involved. And on the 9th of August, we did typing. We wanted to specify which virus was involved, and then we picked up type O, FMD type O, for the first time in the history of Namibia to be diagnosed. And we started tackling that as well. So the vaccination campaign that was going on initially had to stop so that we acquire the necessary vaccine addressing the field serotype that we are dealing with.
When did the current vaccination for the type O FMD begin, and how has it been going?
Well, the current one started on the 21st
of this month,
the 21st of
October,
of September.
Of September.
Of September, and it's actually going very well. Like I said earlier, we had to stop the usual vaccination of SAT1, 2, and 3 before we get the O1. So when we started again, we were targeting all of them, SAT1, 2, and 3, and so far it's going very well. We have vaccinated since the 21st of September. The SAT1, 2, and 3 so far has been 136,000, over 136,000, and the new serotype have vaccinated over 148,000 cattle. And among those, 1,280 has already been repeated, meaning we have already boosted that number, and it's continuing, and I should say it's going very well. Just last week.
Doctor, what is the target for this vaccination campaign, and when do you see it to come to an end?
So we are targeting a total number of 170,000 animals, cattle. And as soon as we reach that number, we'll consider that we have achieved our target, and we actually stop. As to when we look at finishing, our vaccination rate per week is quite good. So we do about 10 to 15,000 a week.
Mm-hmm.
So at the rate that we are, one would say with that number, perhaps in a month or so, we might be able to finish if there's nothing hindering the progress.
All right. Now, Doctor, apart from the mass vaccination campaign, what other actions has the ministry taken to control the outbreak of the disease after detection?
As you might have heard already in the notifications that have been issued by the directorate or by the ministry, we have imposed movement control, and this is simply to avoid animals spreading the disease, because especially the type O, the infectivity is very high. So when you restrict movement, you look at you anticipate that your control measures are working. So we have roadblocks, engagement with the relevant stakeholders, and information sharing with the farmers, and that's very important. When the farmers know what to do, it becomes very handy in the control of the disease.
Mm-hmm.
The movement of any risky materials or animal products like meat, hides, and stuff like that has also been halted.
Very well, Doctor. Has the ministry recorded any livestock deaths due to foot and mouth disease? And if so, is there a figure right now?
Yes, we have recorded a number of dead animals, a number of dead cattle. I can't give you the figure right now.
All right, it's not a problem, Doctor.
But the death was actually recorded due to the severity of the disease. The animals could not walk to feed, and they could also not eat. So most of these animals died because of dehydration and hunger.
Mm-hmm.
And of course, some secondary bacterial infections because they have a lot of wounds in the mouth and between the hooves.
Mm-hmm. Well, Doctor, you've mentioned that the vaccination campaign is going very well. So can I conclude from that statement that the farmers are responding positively to the campaign?
Oh, yes, definitely. Farmers, they really cooperate. They are really helpful in actually they even disseminate information among themselves. I should comment that they are doing a good job, and that's what we really need to tackle this problem now and even in the future.
All right. Doctor, I'd now like us to shift our focus to a different matter where we understand that the ministry suspended the importation of poultry and poultry products from Germany as well as the Netherlands. Now, Doctor, what exactly necessitated the ban and when will it actually come into effect?
Well, the ban of poultry and poultry products that was put in effect followed the outbreaks of avian influenza, highly pathogenic avian influenza in those countries. Every time we have notifications that any country that exports material, meat, chicken meat, or any other products from poultry, we ban importation of such material simply to avoid the spread of such disease into the territory, because it's highly infectious. It can wipe out the whole herd and impose serious economic repercussions. As to when it will stop, that will really depend on when such countries will be able to resolve their problems. And as soon as they do that, they report to the common body, which is the World Organization for Animal Health, or OIE in short. As soon as we see that such cases have been resolved, it's reputable information on that platform, and then we are going to issue a notification that the ban has been lifted.
Doctor, will this ban have any impact on the availability of poultry products in the country?
I suppose it should, because it's stopping the normal flow of importation of such products. So one would anticipate that there might be a shortage of poultry products, not just products, but even, for example, day-old chicks or hatching eggs. There are some farmers who import such from those countries. So one would really expect a shortage in the supply of those products. But we want to assure that as soon as these have been resolved, of course it's out of our hands, but when it's resolved, a public notification will be sent out, and we hope that will happen very soon.
Well, Doctor, thank you very much for clarifying those issues for us. Any concluding remarks?
Okay, welcome for that. Any remark that I might add is just that the traders, especially for poultry products, should just be hopeful. We are doing this to, prevent diseases, actually doing it for the farmers and for the countries, and it's no way a punishment. So as soon as things are in order, a notification will be issued. And regarding FMD, maybe I should just commend the farmers and stakeholders involved for the good cooperation that they've been offering the ministry and the directorate in particular, and that's very commendable. I think that's all I have to say.
Well, thank you very much, Doctor, for taking our time to speak to us this morning.
Thank you very much.
Well, that was State Veterinarian in the Ministry of Agriculture, that is Dr. Elago Simeon, and he was speaking to us about the foot and mouth disease mass vaccination campaign that is currently ongoing in the Zambezi region, and he also clarified some issues regarding the ban of poultry products.